Hi, everyone. Thank you, Rondi, for the introduction. So, as mentioned, I'm Schyler, and tonight I'll be talking to you about my PhD project, which is entitled Sustainable Mental Health Care in General Practice. So, as others have mentioned tonight, we have a rapidly aging population, and at the same time, we have fewer healthcare personnel to support it. So, we need to make sure that we're using their time, energy, and resources wisely. And mental health is a really important part of healthcare systems. And if you have a mental health problem, you're likely to contact your general practitioner or GP first. And between 2006 and 2019, 47% of patients in Norway did just that. They contacted their GP about a mental health problem. And then, correspondingly, in the same time period, 1 in 9 GP contacts were related to mental health. So that might not sound like a lot, but it adds up to a significant portion of GP contacts, resulting in mental health contacts being tied for second place. And only contacts for musculoskeletal conditions, which you'll hear a bit more about later, led to more contacts. So mental health is important both for patients and for GPs. So if you go to your GP about a mental health problem, they have 4 metaphorical tools in their mental health toolbox. They may refer patients to specialist mental health care, do talk therapy between the GP and the patient, prescribe medications for conditions where medication is applicable, or offer certification for sick leave from work. And now, amongst these tools in their toolbox, GPs may have a tendency or a preference to use one more than the other. So say Dr. Sada here prefers referral to specialist mental health care, but then another GP, let's call him Dr. Ped, he prefers to use medication. When new patients come to Dr. Sada or Dr. Ped, they're more likely to receive referral to specialist health care and medication, respectively, because GPs tend to rely more on their preferences when meeting new patients, well, of course, still taking into account what is best for the patient. Okay, so we know that GPs use these tools and that they might have a preference for one or the other. But what we don't know is how these tools are used in combination with each other and how each of these tools might impact patient healthcare use. So let's say, for example, how does talk therapy in general practice affect use of specialist mental health care services? Or what tools might be used in combination with sick leave? So these are some of the questions that I will be tackling in the first portion of my PhD project. And I'm going to spend the rest of my presentation describing to you all how we can study the impacts of these tools using registry data. Okay, so the gold standard way that we would like to answer this question would be to simply randomize patients to receive one of these 4 different types of treatment and then follow them and see what happens. That's because the randomization makes it easier for us to compare between these different types of care. However, unfortunately, that's not feasible. But what if we could randomly assign patients to GPs who have a preference for a certain type of care? Remember how I said that GPs tend to rely on their preferences when meeting new patients? That would allow us to sort of mimic or model this more ideal randomization conditions, because these randomly assigned patients are more likely to receive the GP's preferred type of care if they contact them for a mental health problem. And luckily for us, there are such instances where patients are randomly assigned to a GP in Norway, and we can see this in registry data. So I use this in my PhD project. And so let me explain how it happens. Most patients might choose their GP. So there's little to no randomness there. However, if your GP quits, retires, or reduces their list size, then all the patients left on the GP's list will be reassigned to another GP with available list space. So to illustrate this, let's say that Dr. Steve decides to retire and fulfill his dream of taking a cross-country RV trip. Bye, Dr. Steve. But what happens to his patients? Don't worry, all the patients remaining on his list when he retires will be reassigned to GPs with available list space in the same municipality. So let's say in this hypothetical municipality that Dr. Qadi's list is full, but Dr. Ped and Dr. Sada still have available spaces. So some of Dr. Steve's patients end up being assigned to Dr. Ped, and some end up being assigned to Dr. Sada, joining their existing patient lists. And now neither Dr. Steve, his patients, nor any of the other GPs have any say over how or which patients get assigned to which GP, which keeps this process random. So, given that Dr. Sada has a preference for referral, if any of the randomly assigned patients contact her with a mental health problem, they're more likely to be referred to specialist mental health care. Similarly, if any of the patients randomly assigned to Dr. Ped contact him about a mental health problem, they're more likely to receive medication. And so this all comes together to create a situation that sort of models that more ideal randomization type in which patients are, where instead of being assigned to a specific type of care, where instead here patients are assigned to a GP who has a preference for that type of care. And so I take advantage of this randomization process in my research in order to look at what combinations of these types of care are used and what the impacts of those tools are on patient healthcare use. And so that allows us to answer some of those questions that I posed in the beginning, such as how how talk therapy might affect specialist mental health care use, and what tools might be used in addition to sick leave. And so this information is only one part of my project, because in order to answer the big question of how we should use our mental health care resources, we need more information. We need evidence on patient health, workforce participation, and much more. So that's what I'll be doing in the rest of my PhD. I'll be working to build up these answers to hopefully build a more sustainable mental health care system. Thank you.